Hey, hey, hey. Today we're talking about that sugar that ain't sweet. You know that sugar. You've heard that term a lot. Probably your grandparents have used it. You probably still use that term yourself. Well, what is the sugar that we're talking about? It's diabetes. Diabetes is one of those things where that is the type of sugar that ain't sweet. Okay. And the reason why it ain't sweet is because it causes all these different effects on your body: blindness, kidney failure, amputations, all of these things that we really don't want to have. And you don't have to experience this. Just because you saw someone else deal with it, you don't have to. We are going to talk about some things that you can do to prevent it. And that's what we're going to do today. We're going to talk about actually what is diabetes and mainly focusing on type 2. Going to talk about the diagnosis, and we're going to talk about prevention. We're all about prevention here. And we're going to do it where it is going to be simple. I'm going to simplify it for you because there's no reason to overcomplicate this. So if this is your new time, first time joining, welcome. For those of you who have been following along, thank you and welcome for joining. I'm Dr. Ashley Booth. I'm a board certified family medicine physician, and I provide practical health tips and tools that you can use in your everyday life, because what I understand is that your life affects your health. Now, before I get into it, I want you to go ahead and share and like and always comment to let me know, because I want this to be interactive. I want to know what your thoughts are that sort of thing. Let people know that we are watching, and we're going to go ahead and get into it. So, diabetes, the sugar, it affects people in so many different ways. Of course, we know about that whole physical part of things, right? But it affects people financially, emotionally, because of all the things that it does. In fact, 1 out of 5 people don't even know that they have diabetes. So it affects like 38 million people, but 1 out of 5 don't even know that they have it. And you know why? It's because a lot of times it's sneaky. It has these things like that's going on inside of your body. You may not even know that it's going on, but it's causing some damage. So, what exactly is it? Basically, it is an issue with insulin. Either your body is not making enough of it, or what you have is like ineffective and it's like not sensitive. But what the heck is insulin, and what's this job, and what does it have to do with diabetes in this whole picture, right? Well, the thing is, insulin's job is to take glucose, sugar, and put that, it's supposed to tell that sugar where to go and tell it to go into the cells and do what it's supposed to do to give us energy. Well, you may say, well, I don't eat a lot of sugar. I have quite a few people say, I don't eat sugar like that. I don't eat a lot of sweets. Well, what you eat, a lot of what we eat is broken down into glucose or sugar. And so that's why a lot of people call it the sugar. So that is broken down. When you eat it, the body gets this response and it says, hey, we got something to give us some energy. So then the insulin is released. And insulin says, okay, we're going to get on the cells. We're going to take these cells, tell these cells to take up that glucose or that sugar and put it into the cells so the cells can do what they need to do: make you think, make you run, make you dance, whatever it is that you want to do, right? It gives you the energy to do that. The problem is when you have, or when that diabetic process is going on, the insulin doesn't work as well. So it doesn't recognize that you have all of this sugar or glucose in your body. So then what happens is it has nowhere to go. It's not able to really go into those cells and feed those cells like it needs to. And it lives around in your bloodstream. And when it lives around in the bloodstream, it's doing a lot of damage. Let's just think about it like a car. And I know one of the things back in the day, I don't hear about it so much now, but back in the day, one of the things that you could do if you was really mad at somebody was you could put sugar in their tank, right? And we know that as soon as you do that, it is going to mess up the whole system. It like clogs it all up. That's the same thing that the sugar does when it is in your body. It is in your bloodstream. It is circulating around. It's trying to go to the different places. Your blood is trying to go and do what it needs to do. But it's got all this sugar in there that is affecting everything, all this glucose. And it starts to affect places that are small in the body first, a lot of times, like the blood vessels in your eyes. So that's when you start getting the blurry vision. Sometimes can lead to blindness if this continues. You start going to your fingers and your toes. You start having numbness, tingling. That's the first indication that something is not right. Then that leads to decreased circulation altogether, and you can start having amputations. So, as you can see, this can cause a lot of issues, and we don't want to do that. So, how do we kind of navigate this system? How do I even know that you have diabetes? What is your doctor looking for? What have they told you? Well, let's figure it out, because there are some ways that we can measure it. One of the ways is your urine. So just like you have a glass of sweet tea and you add sugar to it and or Kool-Aid or whatever it is, no judgment, but you put that in there and you keep adding the sugar and keep adding the sugar and keep adding the sugar. At a point, it can only take so much. And then you have the sugar that starts to settle at the bottom. That's the same thing that happens with your body. Once you have all of that glucose in your body, whether you ate a lot of sugar or you ate a healthy diet, but your body doesn't recognize and can't take that, what it processed and turn into sugar and move it throughout the body, either way, what happens is your body says, it's too much. We have nowhere to put this. And one of the things that happens is you start to pee it out. So once we check your urine, and if we see sugar in your urine, that is an indication that you have diabetes. The other place is we can look in your blood. So when we do the blood, you can do a finger stick, and a lot of people do like a fasting. They don't eat anything overnight, check it first thing in the morning, and then we see what does that look like. If that number is over 126, then you have diabetes. Didn't fast and we just checked you randomly at any time of the day, then and it's over 200, you have diabetes. You may say, well, they didn't do a finger stick at my doctor's office. They drew that blood from my arm. Same thing, but a lot of times we call it the finger stick or the fasting glucose. That one you can kind of cheat because you can do really well for a couple of weeks and you not eat anything, you eat really healthy, all that sort of thing, try to cut out a lot of things, exercise, whatever before you go to that doctor's visit, because you don't want them to know what happened, right? Or your body just, you may just fasted for a long period of time. Whatever it is, that number is just a snapshot. That's what I like to call it. It is just a snapshot of what's going on. Now that 200 will catch you every time. Usually it can catch you. But that fasting one sometimes is snapshot. I've had some people that I can check their glucose in because they fasted, and it could be like maybe 60 or something like that. And I'm like, oh, okay. From that, I say, oh, they may not have diabetes or pre-diabetes. That's not necessarily the case because we have one that you can't cheat. The A1C, you can't cheat it. And this is why. The A1C is based off of your red blood cells. So you have your blood and your red blood cells that are flowing throughout your body. And then what it does is, sugar can be a little sticky. And when it's sticky, that's when because like you have a good piece of candy, and you're like, let me get the rest of it off because it's sticky. It does the same thing to those red blood cells. It travels along, that sugar starts to bind to those red blood cells, and then they stick and they stay and they stay and we look at it for a 3-month period. So that tells us about what's going on. A 3-month period, it lets us know what has happened in a 3-month period with the amount of sugar. So, like I said, you could have fasted and done really well for maybe a week or two and come in and they check you with the fasting and your sugar levels look fine, they look great. But if we do an A1C, your A1C will tell a different story. And your A1C will say, something else has been happening along a period of 3 months. And now this is what we have. So your A1C, if it's 6.5 and above, then you have diabetes because that is checking a 3 month. So again, you have your finger stick. You can kind of cheat sometimes because that's doing a fasting or a random. And with those, then we just kind of see it's a little snapshot. But your A1C, not necessarily. That is a 3-month measurement. So we get a chance to see what is going on in that period of time and what your risk factor is. Now, when we think about risk factors, one of the things that you have is prediabetes. That increases your risk of diabetes, right? Well, what the heck is prediabetes? Pre means before. So it is before you actually have diabetes. This is something that you really need to know about because and need to get checked for and find out if you have it, because 8 out of 10 people have prediabetes and don't even know it. You say, well, it's not that big a deal, right? Okay, let me give you some more information. 70% of people who have prediabetes can transition over to developing diabetes. That's how high your risk of developing diabetes is. So if you have prediabetes, they said that 70 up to 70% of those people can then eventually have diabetes. So it's a serious thing. So you need to know if you are in that number, because the number that you want to look for, and again, another way that we test for pre-diabetes is mainly looking at that A1C. We wanted your number, if it is 5.7 to 6.4, that tells me that you have pre-diabetes. It's not bad. There's a lot of things that you can do to get out of it, but you need to know if you're in that range or not, because, like I said, it can significantly increase your risk of diabetes. Now, the other thing that increases your risk of diabetes is if you are overweight. So, looking at your BMI, there's some other calculations and things. If you are carrying something, we're starting to look at the BMI, but not just that alone, also looking at the abdominal fat. So if you're carrying a lot of your weight in the abdominal area, the lower stomach area, the bigger that is, the more likely your risk, or the higher your risk for diabetes. So if you're overweight, obese, any of those types of things, when we look at that particularly, especially in that area, that significantly increases it. The other thing, if you're 45 years or older, that starts to increase your risk. 45 years or older, parent or sibling, that can increase your risk of type 2 diabetes. Like I said, we're mainly focusing on type 2 today. So if you have a parent or sibling that had diabetes, so there is a genetic component to it. So you could be doing all the things, but then you have this family history, and it's like, okay, well, what am I supposed to do? I have some things for you. And the one other thing is being sedentary. A lot of us are sedentary. A lot of us work jobs that you sit down all day, or if you are moving, you're moving a little here, a little there, and then when you get home, you're not really keeping up that activity level. So not being active also increases your risk. So like I said, we talk about the risk, but we also talk about prevention and what you can do. And what you can do is what you can change. So although you may have a family history, grandmother had it, mom had it, sister, brother had it, that does not mean that you absolutely have to have this. So there's some things that you can do. Exercise. Exercising 5 days a week for 30 minutes at a time significantly starts to decrease your risk. You know, the other thing that exercise does, not only does it get your heart rate going and all that stuff, it can either keep your weight and maintain your weight, or it can help you start to lose weight. So that is the second thing that can decrease your risk. So weight loss, as one of the things that you want to be able to start looking at, weight loss. If you lose 60%, well, they said that 60% of people were able to reduce their risk of diabetes by losing about 7 to 10% of their body weight. I know that like 7 to 10%, what the heck is that? And the way that you want to look at it is like 1 to 2 pounds a week. Now, there are some other aids that are out there that are, saying that you can lose 15% of your body weight. People are losing 20, 30 pounds in a month, all that kind of stuff. Sometimes slow and steady wins the race, especially if you don't have anything else to assist you. So getting out, walking, I'm not talking about running and CrossFit and all that stuff. If that's your thing, then great, do it. If that's not, just walk. Get out, start walking, get active, and not walking where you just kind of having a little chit chat with your girlfriend around the park, where you guys are kind of like having a conversation, but it's like a little like having a little breath to it. So you want to make sure that you're really getting yourself up and working and moving and getting your heart rate up. And then balanced diet. So you want to make sure that you have your protein, you have your greens, your leafy greens, and then you can have a little bit of starch. I'm not one who says that you got to cut everything out and all of that, but you have to do it in moderation. You have to do it according to what your numbers look like. But having a beautiful plate, and like someone told me, making sure that it looks like the rainbow is a great start. So you want to make sure that you're doing those things. If you start putting those things into place, then that can start to significantly decrease your risk of diabetes and having all of these complications. But how do you do that? The way that you do it is knowing your numbers. You have to know because, like I said, a lot of people have prediabetes and even diabetes, and they have no idea that they do. This thing is going through the body and creating all kinds of problems, and they have no idea that they have it. So, what do you need to do? Have a checkup with your doctor at least once a year, especially if you're hitting 35, 40, 45, especially. Go ahead, see your doctor so that way we can look at those numbers and figure out where you are and what to do. After you do this checkup, you want to make sure you find the right person because you want to partner with them so that way they can help you figure out this is what we need to do. This is how we're going to monitor it. What does your lifestyle look like? What does this look like? But you want somebody who's going to be able to walk you through it, talk you through your numbers. This is what this means. This is what happens if it goes here. This is what happens if it goes this direction. All of that kind of stuff. And listening to you and what you say, this is how I feel like realistically I can get this done and hold you accountable. And that's what we're doing for our members. That's what I tell them. I was like, I am your health coach. I am the one to be able to help you understand what's going on and figure out how to get you where you want to be. So we partner together and we say, okay, this is what we have, and this is some things that we can do about it, and how are we going to get there? So you want to make sure that you partner with someone. If you are looking to get together with the doctor, partner with them, and have the whole team, because it's not just me. I have my great nurse Fallon, who also helps to put all this together and the pieces of the puzzle. Then be sure to join us because at the end of the day, you want to be healthy. You want to make sure that you can live life and live it to the fullest and do the things that you want to do. Because when these things are happening in your body, you may not know that it's happening, but this is one of the things that I have noticed is that people don't know how bad they feel until they start to feel better. So just let's say it comes back and there's pre-diabetes, and people say, well, I don't want to do that. I do not want to progress to diabetes because this is what's been going on in my family. I say, okay, well, what can you do about it? They said, well, I can commit to walking 3 days a week. Great. They start walking 3 days a week. They feel better. Their energy gets better. They start losing weight. Then they go up to the 5 days a week because it's like, oh, I feel great at 3. Let's move it up to 5. Then they feel better. They start making those adjustments and stuff too. And they said, man, I didn't realize that I wasn't feeling that great until now. I have this great boost of energy and all that stuff. So a lot of times you may not even know that you are feeling bad because it's been going on for such a long time. And that's just how things feel for you. But it can definitely change. So make sure that you get your numbers checked. Make sure that you have someone who can explain what those numbers mean so that way you can understand what you need to do moving forward. Well, thank you guys so much for watching. Until next time, I am wishing you healing and I wish you well, and I will see you soon. Take care.